We are back on Morning Line. Thanks for joining us this morning. We're talking with Shannon Jones. She's with SHIP, which is the State Health Insurance Information Program. I should be able to remember that. Gosh darn it. Anyway, we're taking your calls if you want to jump in. Questions for her, specifically about Medicare.
Right.
All right. Medicare is, and it's open enrollment right now. And, we came about the idea of having you on after yesterday. So many people were asking questions of our Social Security guests and the tie-in on that. Cindy waited through the break, so let's take Cindy real quick here. Cindy, good morning.
Good morning, Nick.
Hi, Cindy. How can we help you?
Okay, well, first of all, my father, he's on the Medicare. He's 87 years old. Mm-hmm. And the thing that I've been having problems with for the last 5 years, nobody's taking it anymore. And the other thing I want to ask her, why in the world are, with Nashville, not that rich of a city, that's for dang sure, Tennessee, and it's showing us in the black for 63% increase on Obamacare. No wonder nobody wants it.
Oh, okay. Well, I thought we would get some calls because it's in the news and politics right now. They're talking about some premiums going up on Obamacare. But again, SHIP is separate from that because you transition, if you're on Obamacare, when you turn 65 to Medicare, which is a separate issue there. Now,
right.
She did bring up this point. Is it more difficult to find doctors these days that take Medicare?
Well, I tell you, probably what is happening with your father is he is enrolled in a Medicare Advantage plan.
Okay, and
in the Advantage plans, you have in and out of network. Mm-hmm. So if you are in an area, every Advantage plan is required to at least have a provider within a 30-mile radius. So sometimes the doctor that your father wants to go to may not be in that Advantage plan. So really this is the time of year that it would be good to call your father's doctors and see which Advantage plans they accept, and then we can help you look at those to see which plan is going to be the lowest cost for him for next year, and that he'll also be able to get to see his doctors.
Now, do all doctors take Medicare?
No.
No. So some doctors can choose not to take Medicare patients.
That's right.
Why would they do that?
You'll have to talk to them.
Is it because they don't get reimbursed fast enough?
I'm sure there's multiple issues, but I don't know.
So I'm just wondering if there are issues along those lines. I mean, I'm just curious if it becomes more difficult when you're a senior to find doctors that do take it, or if there's a premium on that. I don't know.
Well,
if you've heard some people, aside from what you just described,
yes.
It's not missing a plan, if they're just saying, look, I'm just where I live, I just don't have any doctors. If you're in a more rural area, maybe you don't have the options of all the doctors we have here in the Nashville area, and they can't drive 2 hours when they need to go to a doctor, but no one near them takes it. Does that happen much?
It does. With the Advantage plans, with the in and out of network, the insurance company is working with the doctors, the hospitals, to negotiate payment rates and that kind of thing. So when those negotiations don't pan out, the doctor or the insurance company can say, well, this year we're not going to work together, which is normal business. Even with employer coverage, that happens as well. So one of the options is original Medicare with a standalone drug plan and a Medicare supplement. And what happens is with the original Medicare and a supplement...
When you say original Medicare?
Yes, that's parts A, B, and D.
Okay, I'm sorry.
Yeah.
Okay, go ahead, I apologize.
If you have a original Medicare with a supplement, then you can go anywhere in the state or in any state, and if the doctor accepts Medicare, then you can be treated. It's the Advantage plans that have the in and out of network issues that can kind of be tricky to some
folks.
Folks.
Like if you're out of town and you need it, that would be out of network.
Correct.
But if you need an emergency care, well, that's different if you're going to emergency room.
Right. Emergency is different.
By the way, how does that get covered by Medicare?
Well, whether you're in original Medicare or an Advantage plan, then your emergency care is considered in network. Once that care is no longer emergency, then with the Advantage plan, you have to work to get waivers.
That makes sense, because you don't have time to pick and choose if you cut your toe off mowing the lawn. You better get going fast.
That's right.
I don't know why that popped into my head, but that's probably going to happen to me someday. Let's go to Mark. Hi, Mark.
Hi.
Hey, Mark. What's on your mind?
I've got Medicare coverage. I'm 69 years old, and I understood that every year you could go in and have a checkup with your doctor, and there would be no charge for that
A physical.
to you, a physical, right?
Yeah.
So I went in the other day to my doctor, and it's about a month ago, I guess. And anyway, I got a bill here just recently, and there were things like I had a pneumonia shot and had a wellness fee checkup. Anyway, it all came up, which was amazing to me. It was, it was like $400 or $500 for
Holy
this.
cow! For a physical?
I saw, yes, I saw the doctor for all of 5 minutes, and the Medicare part payment is and I don't understand all this.
Yeah.
Payment $222, payment Part B adjustment $383. Anyway, it came down to where it says your payment is now due $15.79, which it doesn't say what that's for. It just says. But I thought when you had the checkup with Medicare, and I've got just pure Medicare, that there's supposed to be no charge for these wellness visits.
Oh, okay. So yeah, and I understand. So wellness visits. There's a good reason why they want to encourage you to go. So you're saying though, Medicare covered everything except $15 for you,
Yes.
right?
Right. Yeah.
Okay. But you're wondering why you have to pay that $15, huh?
Yeah.
Okay, yeah, fair enough. Okay, it seemed like there was some fee. At first I was going to say, if he's paying $500, that's wrong.
Right.
Okay, because I'm with him too. My insurance here sends me, and yours probably, you go once a year, and it's just smart for him to get a pneumonia shot. It's going to save insurance and everyone money if he doesn't get pneumonia. And physicals are covered almost always by insurance.
No.
There's not. Well, mine is,
No.
and his is, except for
No,
$15.
It isn't.
Oh, so they like the idea of then don't go get your physical, get really sick so we can pay a fortune to get you healed up when you get sick because we didn't catch it during a routine physical. That's real smart.
Yeah. So let me explain a little bit about when you go to the doctor for a physical, then there are charges to Medicare, and you'd be responsible for 20%. But if you go to the doctor for preventative services, and if you received your 2017 Medicare and You handbook, in that handbook there's a great chart that shows all the preventative services, which ones are covered 100%, so there's no copay, and which ones may have a 20% copay. So I encourage you to go and look at that list. Wellness visits are covered. Mammograms are covered. Alcohol abuse screenings, depression screenings, those are covered. But physicals themselves, they include lab work and other things that are not covered at 100%.
And so you may, okay, so well, it's still, I think he got $15. He wants to know why he's paying, but that's still a pretty sweet deal there with everything else. I don't have a problem with the $15. It would have bothered me if he was paying $500. But so it's likely there's something in whatever he received where he has to pay a portion of maybe the pneumonia shot or some kind of blood scan.
Right, and I'm hoping,
like
it sounds like he's an original Medicare, so I'm hoping that he has a Medicare supplement that's going to cover even the $15.
Oh, that could be if he has a medical supplement along those lines. So, yeah, physicals, do they... He went, when you say wellness, is there a difference between going, I guess, for you call it a physical or you call it a wellness visit?
Yes.
That's kind of confusing to me.
The wellness visit is more of a screening where the doctor asks questions. Then once that visit is over, you would go back and address the issues that might have come up during that visit.
Okay.
So it's more of a screening. I think that's the best way to explain it. Once you get in and you start running lab work, then it becomes a physical, and there are copays on that.
And there are copays on some. Is do you know, like, is prostate or colonoscopies, things like that covered? Do you know? Do you have any?
The colonoscopy is covered under preventative services, but I don't know if there is a copay off the top of my head. And I know there are some time limits on some of those where you may have to wait a year or two before a repeat for it to be covered.
No, that's true. And that's kind of in most plans, a period of time if you're clear. All right, let's take a call from Imogene. Imogene, good morning.
Good morning.
Hi.
Hi. I would like to ask something. My friend of mine, I was talking to her yesterday, and she has health sprain. And she said that she does not have to pay anything for that plan. And, like what comes out of your Social Security check, the premium. And she says it doesn't come out of her check. All they pay is $55. So, do you know anything about that?
I
Okay.
do.
Okay, good. Well, let's talk about HealthSpring's one of those Advantage plans, right?
HealthSpring has an Advantage
Yeah,
plan,
or
yes.
has an Advantage plan.
Yes.
Okay.
And there are a few that Advantage plans that will pay a portion of the Part B premium.
Okay.
And so it sounds like your friend is in an Advantage plan with Cigna Health Springs that covers a portion of her Part B premium.
Okay. Now, and she's paying, though, I guess she said $55 a month or
That
something
sounded-
along those
that sounded what she was paying.
So that would be the $55 along with whatever she's paying for her Medicare coverage, or is that everything she would pay under that?
Well,
What would you
if
guess? I know you don't know. Yeah.
if she's in a plan that is zero, if the Advantage plan, the health
Mm-hmm.
part is zero premium and the drug coverage is zero premium,
Mm-hmm.
then she very well could be only paying $55 a month.
Okay. And that would be tailored to what her needs are, and
Correct.
apparently that provides the coverage she requires.
Right.
Wow. All right. Listen, let's take a break on that note. When we come back, more of your calls right after this. It's still pretty.